urinary tract infection unless he has it before the operation. Okay, then because laparoscopy is not an invasive operation. Okay, next. Okay, the first choice for diagnosis of suspected deep vein thrombosis of lower limb is يبقى احنا عايزين diagnostic tool. What is the first diagnostic tool in deep vein thrombosis? Yes?
Real-time Doppler.
Doppler. Yes, Doppler imaging is the first tool to, if you are suspecting, شفتوا without reading ده الكلام اللي قلناه. If you don't read, if you cover the options, then you will reach the diagnosis. Okay? What is the bore about this question? It didn't give you a scenario. المفروض يكون في يقول لك عمره بيشن عمره كده عملوا له وجابي كده ويدينا clinical scenario. This is a very short stem. It's not giving a scenario. Better if we make it a 50-year-old lady presented with tender calf muscle and swollen lower limb and suspected to have deep vein thrombosis. What is the first diagnostic tool you will do? كان تكون أحسن مش كده؟ لأن it gives a scenario about a patient مش كده؟ It's more like real life patient presentation rather than a mere knowledge. You get it? And this is not a good question. So if we make it in a scenario, it will be a good message. Okay, next. The best initial therapy for deep vein thrombosis of the lower limb برضه still ممكن نحطها بنفس الكيس نقول a 50-year-old lady presented with a swollen tender left leg or lower legs and both legs, and she has suspected to have deep vein thrombosis. What is the best initial therapy? It will be better مش كده؟ What is the best initial therapy? بدون ما اشوفوا الاوبشنز دي. As you see, its placement of vena-caval filter is not an initial management. ممكن يكون to prevent if the patient has a history of repeated deep vein thrombosis وعنده we are afraid that this thrombi goes to the heart, then we can put we can put a filter في vena-caval مش كده؟ And it is not a fair initial treatment. The streptokinase usually is not used in deep vein thrombosis. Streptokinase used in problem coronary arteries مش كده rather than deep vein. Venous thrombectomy, usually we don't do venous thrombectomy unless it's including the whole major vein. Warfarin is not an initial management. As you know, warfarin needs 3 days to act مش كده. So the initial treatment is heparin. Okay?
Yes.
Okay.
Yes, it's clear.
Next. Okay, thank you. Next. At 20, this is the best question. This is one of the best questions actually. Yes, a 25-year-old patient presented with multiple traumas and he had received blood transfusion for 1 hour, during which he developed fever, itching, and difficulty in breathing. What type of transfusion reaction he most likely having? In 1 hour. لاحظوا زول ده بس 1 hour. بس أثناء ما بيدوا في
Hemolytic reaction.
Yes. What is it? Yeah.
The allergic reaction.
Allergy.
Yes, it's allergy. It is allergic reaction. What is the most likely cause of allergic reaction in blood transfusion? Incompatibility مش كده؟ The blood is incompatible مش كده؟ It has to check the incompatibility of the blood transfusion مش كده؟ Okay, hemolytic reaction will need time, definitely. Delayed reaction will need time, it is not 1 hour. Physiologic reaction usually ما بيكون فيه difficulty in breathing. This is a very serious. It's not a physiological reaction. Allergic reaction is most likely because it is 1 hour and it is most likely. Pyrogenic reaction, it needs time to pyrogen to act. It needs more than days to act. Okay, you get that? Okay, a 56-year-old woman presented with a small pigmented lesion on her forearm, which has been growing over the last 2 months. يبقى هنا الكي وورد شنو؟ 56-year-old woman, a small pigmented lesion on her forearm, growing for the last 2 months. She is a fair-skinned woman with a history of sun exposure. What is the most likely in an elderly woman with fair skin and having a long history of sun exposure to develop? What pigmented lesion she's likely to develop?
Squamous cell carcinoma.
Squamous, is
Basal
it
cell.
related to sun?
Basal cell.
Basal cell carcinoma.
Most common
Yes,
skin
because basal
cancer.
cell most common in the fair skin women with history of sun exposure, they more likely to be basal cell carcinoma, while squamous cell carcinoma is not related to the fair skin or not related to sun exposure. First degree burn usually is if usually it needs to have a burning sign. Cystic hygroma is a congenital anomaly. It's not. This is an odd option. مش كده? This is a very odd option. You agree with this? Strawberry hemangioma also is a congenital. Both cystic hygroma and strawberry hemangioma are odd options. They are bad options. Okay, because they are not related to the problem. Okay, next. Which is of the following is not associated? What's your opinion about this question? Can we make this question better? It's a negative question. مش كده? Negative question usually are not acceptable. You agree? So better to make it a positive. Which of the following is associated with decreased risk of infection after major elective surgery? يبقى ممكن نبقيه كده يبقى positive بدل ما كان negative. مش كده؟ والإجابة يا which of the following is associated with a low risk of infection after major elective surgery? Age over 70, extremities of life, they are associated with increased risk. So it's not an answer. It is not a right. It is a wrong option. Chronic malnutrition, as I have said to you before, that malnutrition is a major cause of مش كده? Major cause of post-operative infection following surgery. Long-term steroids will reduce immunity and the patient will be more susceptible to infection. Infection at a remote body site, as you know, this is will also increase the possibility of wound infection if the patient have another foci of infection. This will go to the wound through the blood or through the skin. Okay? Control diabetes mellitus. What do you think? What is the answer? Okay? What is the
Control
answer?
diabetes. Control
Yes,
diabetes.
control. Actually, well-controlled diabetes mellitus, the patient will be like more like the normal population. You get that? So controlling the diabetes is very important because it will make the risk of infection is like the patient, the normal average patients below the age of 60 with no malnutrition, with no use of steroids, with no infection at remote body site. So control diabetes is making the patient less susceptible of infection. Okay, but uncontrolled diabetes will make the patient susceptible to infection. Okay. This question, a 40-year-old woman was found to have a 3 centimeter firm and smooth mass in the upper outer quadrant of her breast, good right breast. 7 ml of bloody fluid was aspirated from this mass. Okay. The appropriate management at this time, خلاص احنا لقينا lesion 3 centimeter firm smooth. الراديولوجيست دار عمل FNA لقى فلويد، لقى bloody fluid، يعمل شنو؟ بدون ما تشوف الاوبشن لان الاوبشن ذاته ما.
Cytology.
What is the option? Huh?
Cytology.
In any swelling, if you find the cytology, yes. In any swelling, regardless of the breast or in the thyroid or anywhere, if you aspirate it and you find it containing bloody, then you have to do cytology for the aspiration. Okay? You get that? All the other options are wrong, actually. They are not right at all. They are not relevant. So they are bad option. This question will give you a clue that the other four options are bad options. They are not right. Okay? So this is one best, it's not one best. This is one right answer. Another patient with signs of hyperthyroidism is about to undergo thyroidectomy. كان أحسن من كده نقول شنو؟ نقول 30 years old lady with signs of hyperthyroidism is about to undergo thyroidectomy لأنه أحسن نقول ندي العمر وندي الجندر مش كده؟ نقول مثلا بدل ما نقول an older patient نصلح السؤال ده نقول a 30-year-old lady with signs of hyperthyroidism is about to undergo thyroidectomy. One of the common complications during thyroidectomy can be avoided is what is the most major complication of operating on thyrotoxic lady that can be avoided? Yes.
Thyroid storm.
Thyrotoxic crisis. Yes. So this is the answer. This is injury to the recurrent can happen, like it is not cannot be avoided sometimes. Injury to superior laryngeal nerve can happen and can be avoided, but it is not. All these can happen and can be avoided. Like in the most important and the most serious is the thyrotoxic crisis. عشان كده تخلينا هنا to choose the thyrotoxic crisis. Symptomatic hypocalcemia, this will occur later as post-operative complication, مش كده؟ And it can be avoided, مش كده؟ Post-operative hemorrhage and wound hematoma also can be avoided, but the most serious one of them عشان كده قبيل قلنا you choose the best answer according to the seriousness. All these complications can happen post-operative following thyroidectomy, but the most serious one and the most one that can be avoided, easily to be avoided, is the thyrotoxic crisis. And the most one important to be avoided is the thyrotoxic crisis because it is a serious post-operative or a serious complication. Okay? You get how we choose this? This is a very good question. If we make a little modification of it of beating a 30-year-old lady rather than another. A 65-year-old male presented with a tender lower abdominal swelling, and lower abdominal swelling below the umbilicus, and inability to urinate for the last 12 hours. The most likely cause of his condition is, what is the most likely cause for a 60-year-old lady, 65-year-old man, gentleman, presented with a tender lower abdomen and inability to urinate for the last 12 hours. What is he has? What is he has من الكلام ده عنده شنو حاصل? What is this condition? Yes.
BPH.
لا BPH BPH is not the direct cause, but what is the direct problem? What is this patient have? Abscess. Abscess كيف؟ في أي كلام هنا عن abscess؟ البيشن عنده inability to urinate وعنده tender abdomen، ما في حاجة بتلمهم الاثنين سوا؟
chronic bronchitis.
لا كده أنا am not asking about the options and so on. عيان عمره 65 سنة
عنده acute urinary retention.
Acute urinary retention because it is tender lower abdomen و 12 hours و inability to urinate و 12 hours و tender abdomen دي ماشية مع شنو؟ Acute urinary retention. What is the common cause of acute urinary retention in 65-year-old males?
Stricture.
Stricture in 65 years old?
benign
prostatic hyperplasia, yes. يبقى الquestion there is a very indirect, like it's a good question actually, because the common cause of 65-year-old males acute urinary retention is benign prostatic hyperplasia. This is the common. نرجع تاني إنه قلنا إحنا we choose the one best answer according to the common, the serious, مش كده؟ Important, suitable. You get? So this is the commonest, the most likely cause اللي هي بيسأل عن الcommon. الcommon is benign prostatic hyperplasia. As you know, carcinoma of the prostate is not that common. Prostatic abscess is not that common. Urethral stricture is not common in this age. It's common in the younger, 20 or 30 years or 40. Chronic prostatitis برضه is not that common in the elderly.
سجاد.
Okay.
طيب مستر طبعا
لا كان في البداية
السيشن عمر فرح ميوت يور سيلف بليز. السيشن هيخلص دلوقتي.